Hi guys, I'm Lakshmi from the Instagram account An Indian Girl's Journey. I'm a physician from India and I have recently matched into an internal medicine program in the United States. Hello everyone. For the next episode, we have with us Dr. D. She has matched into pathology residency this year along with me, and she's someone I've known for a long time, ever since the beginning days when I just started out with my blog. So, hi Dr. D, how are you doing?
Hello, I'm good. How are you?
Good, good. I'm really glad that we could make this work and we could have this interview for everyone to hear your side of the story.
Yes, finally.
Yes. So let's just get straight into the matter that we have to discuss today. And do you want to tell me a brief introduction about yourself so that everyone listening can have a background information, how you got to this point, stuff like that?
Yeah, sure. So, as you said, I'm currently a PGY1 pathology resident, and I did my medical school in Iran. I graduated like 5 years ago, and then I had to do a return of service, and then I started working as a researcher. I also did a lot of research during my medical school, as I was always interested in that.
Okay.
Then I think, I moved to the US like a year and a half ago, and I was doing a postdoc fellowship, during which I had to take my step to CK and to CS, and I also applied for residency here.
Okay, got it. Other aspects of your CV, like, whatever you wish to reveal regarding scores, research experience, visa status and stuff like that, whatever you want to talk about.
Okay, so about the most important aspect of my CV, I guess, is research, because I've been doing that since medical school. And everywhere that I went for interviews, they mentioned that, we know that you probably want to do an academic job for the future, because that part stood out, and everybody thought that, this person with this research background will probably want to do an academic job. So this was one point. And so I took my step 1 when I was in Iran. And then when I came to the States, I had to take my step 2 CK and 2 CS here, which was a bit challenging because I was doing a postdoc at the same time, and I had to manage both. And this was a bit challenging, So
I can imagine.
And about what else?
Visa status, if you wish to reveal that.
Yeah, sure. So I came to the States on J1 visa status, and then I applied for a green card. The results of which is not ready yet. It's a very long wait list, but I could start my residency on EAD, which is the Employment Authorization Document, and it's not a J visa, but it's like a pending status.
Got it. And you already mentioned that you graduated 5 years ago.
Yeah.
So the next question I want to ask you is, what are the difficulties that you've had to surpass to get to this point where you are right now? You're a resident in the US, which is, something that everybody dreams of. So anything you want to share regarding that?
So the first thing for an Iranian to start residency in the US that they think of is their visa. So that was a bit scary for me at first, before applying for a visa, and before gathering information about what you need to have, what you need to present, and all of those stuff. But I guess if the application for the visa is complete, that would not be a problem even currently with these current circumstances.
Got it. Okay.
And so the other thing was taking the steps.
Yes.
And yeah, that was a very long story. Yeah, because like it's not like the American graduates who take their step one during their medical school, and like they have all the information that they need during medical school, and then they just study for a few weeks or maybe a month or so. I think so. Yeah.
Yeah. Yeah.
And then they sit for the exam, and yeah, like that. So for like IMGs, and like I know for those from my country, that it's like an average of 1 year, maybe a little less or more, that they study for the steps for step one. I mean, if they are starting with step one, which is the most common thing that people do, although there are other people that took the like step two first and then they go for step one. But like if they start with step one, it's like an average of 1 year, maybe like from 8 months to 1 year and 4 months, or like something like, yeah, this is the average, I guess. And yeah, so at the beginning when I started, I could never imagine that I will be an ECFMG certificated. I mean, yeah, because it was a very long way, you know, like taking step one, step two CK, step two CS, and you never know when it's gonna be over.
It feels like it's a never-ending journey at some point.
Yeah, exactly.
And then it's done, and you cannot believe that you actually, went through all of it, and you're actually at the other side of it.
Yeah, and I remember that
totally
like
agree.
when I was taking step one and I was reviewing all this stuff, I was shocked for one moment when I thought that, like, did I study all of this material during this time? I mean, this was like a lot of information, you know.
Yeah,
Huge
totally
amount of
agree.
information, yeah.
Yeah.
But I just wanted to say that this is possible, and then when in the end you look back and see, oh wow, did I do this? And then that is like a feeling of relief.
Yeah.
Yeah,
definitely.
and excitement.
Definitely.
Yeah.
And what exactly got you interested in USMLE? How did you, come into this path?
To start like for, you mean how did I decide
consider
to come
USMLE
to US?
and yes.
Okay, so the first thing that made me think of going to another country for residency was that I wanted to be exposed to other the best technologies that are available, especially for my field. Like best devices, and especially on the research side, because that was very important for me from the very beginning.
Okay.
And I think that was the trigger. And then I started looking for the opportunities in other countries. And then I thought, number one, US is has the best universities, and then there you will have more opportunities to study in better universities, in some other countries you might have good opportunities, but they are not as frequent as what you find in the US.
Definitely.
Yeah, so as they say, it's the country of opportunities. So yeah.
Definitely.
Yeah, that's why I ended up here.
Good, and we're glad you're here.
Yeah.
Now, on to the next question. What do you think is important for pathology? Like, what is it that the program directors in pathology look for in an applicant?
So it's, as everyone says, it's a package. It's something that it's a combination of several things. Number one, step scores. Then previous work in the same field, like any kind of observerships, any kind of research, anything that proves your interest in that specific field. Here I'm talking about pathology. And the other thing is that, have you been productive for the past years? Like if you're a recent graduate, so you've been doing your medical school, or if it's been a while after being graduated. So what have you been doing, and have you been productive during those years? And yeah, I guess, and also your English proficiency, I guess.
Okay, makes sense.
Yeah.
And since you brought up scores, what score exactly would be competitive for an applicant in pathology?
So the cutoffs are not as high as other specialties. I think for some universities there are no specific cutoffs, and for some like maybe 220, for some like 230. I've heard of some universities that don't accept those below 230, but you know, there are so many universities that although yeah, you're losing some of your options if you score lower, but in general you don't lose your options, but at the same time the package is very important. I mean, scores are not the only reason that you're not accepted in a program.
Okay, that makes sense.
Yeah.
Okay. And would you consider research to be indispensable for pathology, or would you say it's something that's good to have on your CV?
For residency application, it's something that is good to have on your CV. It's not something that you really have to do, like, but it's very helpful. For me, like, I had several research experiences, but there were no real observerships in the States. And as I said, it's a package, and like several program directors asked me, have you done an observership in pathology? And then I said, I didn't mention that I don't have any in the US, but I said, yeah, I had like in my country, in another country. And yeah, I think that is also very important. I mean, it's like a balance. You can say that I had observership, so I don't need to do research. If you do that, like if you do that all together, that would be much better.
Got it. And
you
other
always,
than research,
and you always have to have a convincing reason why you did something, like why you did or why you didn't do something.
Okay.
Yeah.
Okay, sounds good.
I mean,
and,
sorry again. So
it's okay, continue.
Yeah. During the interviews, it's very important, like the presentation, how you present yourself is very important. I mean, as I said, it's very important for pathology residency applicants to have a related field of work, like to show that they are interested in this field in specific. But I've seen some people that had other interests and they applied for this field, and like some people might apply for different fields, but the thing is that if you have something that is not related to the field that you're applying for, you should have a convincing reason why you did that. And
that makes perfect sense.
Yeah, and this is important in all the fields, but is even more important for pathology, because most of the program directors are suspicious of whether you like this field or not.
Okay, got it. And that's a tendency that a lot of people do have to, apply to multiple specialties, have backups, and that's something that programs really don't like to realize. You know, if they feel that you're their backup, they're not going to rank you. They don't want someone who's applying there just for backup. They want someone who wants the program really badly. So I totally agree with your point there.
Yeah, exactly. And I was told by several program directors that like, we know that our program is very good, but at the same time we have like certain limitations here, but we want the resident who comes here to be happy here. And we want them to like the program and not just rank it because it's like higher level or lower level program. We really want them to be happy here. and like the program that they apply for. And this does not only applies to the like location or the university that you're applying for, but it also applies to the field that you're applying for. So they don't want someone who doesn't like pathology applying for pathology, and like in the middle of the way thinking that I wish I did something else. And especially for pathology, which is different in terms of like you're not directly interacting with the patients, and it's kind of different from other fields in medicine.
Yeah, definitely.
Yeah.
I guess, like you said, this would be one situation where it's a good idea to put all your eggs in one basket rather than, you know, having multiple baskets.
Yeah, exactly.
And doing something for everything. When applying to residency, it really helps to focus on the thing you want and just make sure that you drive in the point that that's what you really want.
Yeah.
So, yeah, that's a good point. And, okay, and moving on to the next question. Other than research, what else do you think were in your favor that helped you get to this point?
I think the recommendation letters are also important. I mean, I'm again talking about a package. So it's
Yes,
a
definitely.
package that has different different fields, and it's the score, it's your like history, like the stuff that you did related to the field, and like your background, and also the recommendation letters and the personal statement. And these are all the different things that you include in your ERAS CV. So, I mean in your ERAS application, not the CV. So I think the recommendation letters are also important, and you have to think about them in advance. For an American graduate, it's not a thing to really think of because they already have their own, but as an IMG, it's like you need to really think about it beforehand, because you need those letters before applying for residency.
Okay.
And
yeah, continue.
so there are like 3 to 4 letters required for the application.
Oh yeah, I was just going to ask you about that. Okay.
Okay. Yeah, so there are 3 or 4 letters, at least 3 and a maximum of 4 that you can use for each program.
Okay.
And so I applied with 4 letters, but if you apply with 3, it's also good. And so one thing that many people ask is that, like, I am getting a letter from a very well-known person, or I am getting a letter from like an instructor or an assistant professor which is not very famous in the field. But I just want to say that although I know that the person who writes the letter is important, but the most important thing that is what is mentioned in the letter. I mean, I know people who got letters from very famous people in their field, but because what was written inside the letter was not great, they could not get a good position.
Okay. That's a good point.
Yeah.
I mean, we tend to think, oh, just the name is enough, and this certain professor might have just seen you around and would write a really mediocre letter compared to this other professor who's not a big name person, but he knows you better and he has a lot of great things to say about you. So always better to go with the latter person rather than the big named person.
Yeah, and there is also one other point for IMGs which they always consider is that, is it better to get a letter from an American or from someone from my country? And I guess they are not exactly equally good, but kind of equally good.
Oh, is that so?
I think so.
So do you mean that it's okay to get the letter from the professor that you had in your medical school?
Yes. So if you have options in the US, it's better to go with your US options. And if you think the quality of the letter is going to be as good as the one that you can from the person in your country. it's better to
Okay.
go with the US letters. But if you have, like, a friend of mine once told me that a program director told her that she has to get a letter from her country because the duration of her stay in the US was not long enough to reflect all of, like, her complete background. So they needed a letter from her medical school, like, where she
Okay.
spent a long time, and they wanted a letter that showed how she performed during medical school.
Okay.
And so
And
that's one of the reasons that I say, like, a letter from your country is also equally good.
okay. And are you talking about the letter of the department, the head of the department that you're applying to, or any letter?
Any letter. I mean,
Any letter.
yeah.
Okay. Yeah, that's interesting because, with mostly clinical specialties, the impression that I've gotten is that they really prefer to have American letters, but then it could also be because the whole clinical practice here is really different from our home country, and I feel pathology would be a little more similar to each other than the topics like internal medicine, maybe.
Yeah, that's a possibility. But I
Yeah,
know
makes sense.
at the same time, I say that, yeah, if you have a letter from the US, that's gonna be better. If you have your options
Yeah.
in the US, okay, so choose your options among the US attendings. But if you don't worry about it. A letter from your country
Okay.
is also good. But
That's good. That's good to hear.
yeah, but I don't say that, like, if I get, like, someone might ask, okay, I get 3 letters from my country. I don't think that is a good idea. I think if you like at least 1 letter from the US, maybe.
Okay.
Yeah.
Got it. Sure.
And one other point is that some people might say, okay, this person is going to write me a good letter, but I don't think that a good letter is good enough because, like, especially for the US people, the letters that you get are either good, great, or very great. There are no bad letters. No one writes you a bad letter. If they accept to write your letter, they will write at least a good letter, and a good letter is not competitive enough.
Got it. Okay. Makes sense.
And one other thing was, people ask me, how can we ask for letters? Like, I spent a few days or maybe like a few weeks with this person. Are they going to accept to write me a letter? And I would say, ask them this question: do you feel comfortable to write me a letter? And then they will say either yes or no. And if they say yes, okay, go for it.
Yeah. I mean, even I found myself very awkward to ask the question. I was like facing outside the room. I was like, oh God, I don't know how I'm going to do this.
Yeah.
But yeah, it's something you have to ask. I mean, if you're just shy to ask and then, you just leave, you would have just hurt yourself by not asking for it.
Yeah, exactly.
Because you might never see them again.
Yeah, exactly.
So.
I personally had this experience where I asked the professor, do you feel comfortable writing me a letter? And then he didn't say no. He just said, okay, I think you have your other options, like you can ask for a letter from blah blah, from blah blah. And then I felt, okay, he's not comfortable writing me a letter. Yeah, so I didn't insist. And then I said, okay, thank you very much for your help, and okay, bye.
Yeah, and that's totally fine. I mean, it's better that they kind of somehow give you the idea that they're not very keen on it, rather than write a very mediocre bad letter that would just hurt
exactly.
you. So that's something really nice that they do for us, in my opinion.
Yeah,
so
exactly.
that's totally fine. Yeah. Okay. Okay, moving on to your the next question that I have for you. So what is it that you wish you knew when you were starting out that you know right now that you're at the other side of the journey?
Maybe I wish I knew that it is possible.
Definitely.
Yeah.
Yeah, it always seems impossible on the other side, and then once you're here and you're like, why did I even worry about this?
Yeah, exactly.
So yeah. That's a good one.
I think I have very good friends that helped me along the journey.
Okay.
And I think, yeah, like every step that I took was with their help. So I
Yeah.
asked all of my questions, none of them remaining unanswered.
Yeah.
And yeah, I think I was a very lucky person.
I think I remember, like, I came to the US in January of last year, and you had already taken your CS, and then I remember messaging you and asking you about CS. You actually shared your number, and we had like a really good conversation where you
Yeah.
talked to me about it.
Yeah.
I think you had just started your research, and you were getting settled. I still remember that.
Yeah, exactly.
So yeah, I can say the
You have a
same
good
for you.
memory.
You were a really good friend. Of
Yeah,
course,
thank you.
I don't forget, the kind things that people do for me. So that's something I really appreciated when you took the time out. I could tell that you were busy with your research and everything, and you took the time out to speak with me and, give me an idea.
Yeah, sure.
So
Yeah. Yeah.
Okay.
I got so much help from my friends, and I will be happy to help anyone who needs help.
I mean, that's the whole thing, right?
Yeah. It's
we
a very
we
vague,
get help.
vague
Yeah.
way, yeah, like you don't know
Yeah.
what's coming next. So yeah.
Yeah, so we get help from others and we pay it forward to others, so that's how the whole thing
Story goes,
sustains
yeah.
itself. Yeah. Yeah. Okay, so coming to the next question, is there anything else you would like to share to the people listening to you today? There might be really, really young budding medical students who are passionate about pathology like you, who must be looking up to you right now. What do you want to tell them?
I would say first, be passionate for pathology and then apply for it, because I know people who did pathology and after residency they started to think for applying for other specialists, and so this is the first thing. So like think about it beforehand. I'm still in the beginning of the way, but I think like I like pathology from the very beginning, and that's why I feel good for with starting this journey. And the other thing is, again, I have to mention that never think that it's not possible with any kind of background that you have. Although I say, it's better to have a related background, and like it's good to have good scores, it's good to have like observerships, it's good to have research, it's good to have like it's good not to be an old graduate, because like this is one question that we get asked a lot, and I guess for some other specialties like surgery or like other specialties, it's more important to not to be an old graduate, but for pathology I don't think that there is a cutoff for most of the programs.
That's an interesting thing, because I did not realize this, and it makes sense. If you are away from medicine for a long time, you forget examination. If I just ditch medicine for a couple months, I will forget how to check for fluid thrill or some random things. So that makes sense. Okay,
although
that's
I know,
good to know.
Although I know some programs that care for step 3 score, and so there are some programs that don't accept IMGs without a step 3 score, because they are concerned that you will be a pathology resident and you will not have clinical experience when you start residency, and then you will forget all the information that you had during your medical school about like all the clinical information, and then it would be difficult for you to pass your step 3. So there are a few not so many, but a few programs that care for you taking this test before applying. And for some, it's a plus point that yes,
I mean that makes sense, because a lot of internal medicine is there in step 3, and if you are way into your first year and then you take, and you might not remember a lot of things, but obviously it's still challenging to be able to take step 3 before you apply. So,
exactly. I plan to take step 3, but I was not able to. So
Okay, You can take it this year too. That's
Yeah.
I mean, I think you'll be fine because your step 2 was recently, right? It
Yeah.
was not like, 4-5 years ago or something like that. So it should be okay.
Yeah.
Yeah.
I hope so.
Okay. Yeah. And so any regrets, I'm sure you're at a happy place right now, but anything that you wish you had done differently that you want to share with those listening right now?
Maybe one other thing is that when you apply, try to apply with a complete application. Some people, it's not always possible.
Yeah.
Like what I went through, because I applied without my step 2 CK score, and then I updated all of the programs.
Oh yes,
later.
I remember talking to you about it. Yeah.
But if you can apply with a complete application, because then you will have more options. Because there are some programs that send out their interview invitations like sooner, and then if you don't have a complete application, they will not consider you at all. Although you will still have your options, because there are some programs that don't care for you not taking step 2. I mean, I got some interviews even before having my step 2 CK score, but I know that I lost some of the options.
Yeah, and I'm sure even though you did not have step 2, your research background really helped, especially since it was in the US. That would have been a lot of help as well.
Yeah.
So, especially if you don't have a lot of clinical experience, research experience or US experience, definitely at least have a complete application when you apply.
Yeah, exactly.
Yeah, that makes sense. And about step 3 also, like, I think a lot of specialties are going in that direction. And personally, that's something that really worked in my favor as well, because I got my step 3 score like 3 days after I applied, and I literally got a very good excuse to reach out to programs with. And because everybody else sounds interested in your program, blah blah blah, but mine had a great subject line, that step 3 score of so and so, and that's something that catches the attention of the program directors more, rather than just saying I'm interested in your program.
Yeah.
So that I feel is a good idea. So I would encourage everybody to take step 3 if they can.
Yeah, exactly.
Yeah.
And the other point is that presentation, like how you present yourself during the interview, is very important. And focusing on the positive aspects of your CV, because it's you who directs the direction that the conversation is going to. So if if you start with something, then they will start asking you those questions about those stuff that you talk. Like the first question that they usually ask is, tell me about yourself. It's you who talks about what you have done before, and and then they will ask you questions about those stuff. So it's again you who rules the conversation.
Yeah,
and
that makes sense. I mean, I used to always try to turn the conversation towards lighter things like hobbies, where you just feel more comfortable talking rather than, I don't know, some weird questions that you might come across.
Yeah, exactly.
So that's a very smart thing to do. Direct it in the direction where you would like talking about it. So
there are still times that unwanted questions come up, but just you need to be self-confident and at the same time humble in answering all of the questions. Like this should be your attitude, and practice before the interview.
Yes. I mean, if you don't practice, any question can really surprise you. Even just I remember randomly I had gone for a job interview in my home country, and they told me to tell them about myself, and I was just so taken aback, what do you tell about yourself when they just ask like that? So even something as small as telling about yourself needs a lot of practicing to put your best foot forward and put across the best things about yourself.
Yeah.
So that's definitely a good point to mention, that interview practice is very important.
Yeah, exactly. And one good thing to do for practicing is to take a video of yourself while you are presumptively answering those questions, and
Yeah.
watch that video, because all of us have some habits that we are not aware of, and like we do some
Yes.
things that we don't know that we're doing, but those might be effective during the interview, and yeah, might have bad
Perfect.
effects. Yeah.
Yeah, totally agree. So I did not do that. That was actually a very good idea. I wish I knew that sooner. But something that I did was, we formed this group of 5 of us, and we would put across questions to each other, and we would send voice memos of our answers.
Yeah, that is
And
good also. Yeah.
yeah, so we did that, and then this person just said, you say a lot of in your conversation. You might want to cut down on that.
Often
And
to
I was
many
like,
people.
so I was like, okay, I'll keep that in mind, and that really helped. So sometimes a lot of things that you miss might be caught by somebody else, and then that can help. So practicing with others also would be a great thing to do.
Yeah, exactly.
Yeah. Okay. So that was a great answer. Okay, coming on to the last question. I don't think I told you I would ask you this question, but like just just spontaneously, I just want to ask you, because I myself am curious. How exactly is life as a pathology resident so far?
Yeah, I mean, it's just like a few months that I have started residency, and it's been
Okay.
very good so far.
Okay.
So yeah, I think it's as I expected it, and it's a very diverse field.
Yeah.
And yeah, there is a lot to study. This is one thing that someone who aims for pathology residency have to have in mind. And
Of course.
yeah, so it's a lot of, like, there are not so many shifts or calls that you look for, but you will have a lot to study.
Okay.
Yeah.
It's more of an academically oriented residency, I guess.
Yeah, maybe.
Okay, makes sense. Okay. Okay, so it was really nice talking to you today, and I hope that the things we spoke about will help inspire and give a good idea to future aspirants. And yeah,
Yeah,
so
I'm
that's
very
about
happy
it, I
to be
guess.
able to share my experience, and I will be happy if like this could help even one person.
Yeah, definitely. Yeah. Because there are so many misconceptions, and that's what you're trying to do, where we're giving them the right information. So
Yeah,
that,
I remember when I was starting, like I asked very dumb questions, like very simple questions, and yeah, as I said, it's a very vague process, and yeah, it's like every step comes after the other, and then you will come to the end. Although it's not an end yet.
Yeah. Yeah. And do a lot of people from your country do this, or are you one of the exceptional and rare ones to take on such challenges?
Well, there are not so many people doing this, but there are enough number of people doing this.
Okay, got it.
To have a good community of people helping each other.
Oh, that's great. Yeah, that's what I mainly meant to ask, because when you don't have a lot of seniors who've been through the process who can actually guide you about it, it can get quite challenging.
Yeah.
Okay, I'm good that you had some support for the whole process.
Yeah, but if I want to say like the percentage of people from like maybe from my university, like maybe less than 5%.
Okay.
Are going.
That's still not too bad.
Yeah.
Yeah, because I have some people telling me that they're the only one from their college who's applying. So that's very different. So that's good, as that you have somebody who's done it and can help you out with the process.
Yeah, exactly.
Okay, sounds good. So I guess that's all we have for today, and it was really nice talking to you. Though this is not my first time talking to you. So I'm sure the others agree. So that's about it.
Yeah.
Thank
you.
Okay. Yeah, thank you for taking the time out.
Yeah, sure.
Okay. Have a good night.
You too. Bye-bye.
Bye. So that's all for today, you guys. I hope you liked this video and that it helped you in some way. If you have any recommendations for future videos, please leave them in the comment section. I would love to hear more from you all. If you like this video, please give it a thumbs up and subscribe to my YouTube channel. You can also follow me on Instagram at An Indian Girl's Journey. Thank you for watching and have a nice day.